Welcome to Meet the Docs with your host, Grant Otten, brought to you by Columbus Community Hospital.
Welcome to another edition of Meet the Docs, brought to you by the Columbus Community Hospital. I'm Grant Otten, and I'm sitting down with Dr. Geoffrey McCullen, and we're going to be talking a little bit about the spine and some other things today. But before we get started, can you tell me a little bit about what you do here at the Columbus Community Hospital?
I'm an orthopedic spine surgeon from Lincoln. I come here every week on Wednesday. I've been coming to Columbus for the last 15 years, and I have started to do some surgical procedures at the Columbus Community Hospital.
And so over these years that you've been working here, what kind of growth have you seen at the hospital, and have you enjoyed working here and kind of advancing your practice?
Oh, absolutely. What a tremendous changes that have occurred here. Of course, the facility and the operating room, the equipment in the operating room, the offices.
Well, and talking about a little bit about your journey getting into the practice itself and your medical journey, can you talk a little bit about the schooling that you went through, and eventually you were the chief of surgery or spine surgery at the U.S. Navy Medical Center in San Diego?
Well, I went to college out in the East, and after college I joined the Navy, and I was part of a Navy scholarship program where they pay for the medical school and you get a stipend. After that, I went to medical school on the scholarship at Cleveland at Case Western Reserve, and after that I went to residency, and then I did spine fellowship training after that in New York. After all of that training, which was 7 years of training outside of the 4 years of medical school, so 11 years total, I went to the Navy, and I spent 4 years at the Naval Medical Center, San Diego. And I was the person in charge of the spine surgery program for the Navy.
And taking that experience, has that helped you improve your care when you talk about working in areas like Columbus?
Oh, I think so. The time in the Navy, of course, we see a variety of cases and patients. And we also had an opportunity to work with and teach residents. And I think that makes you a better doctor overall, because you're constantly fielding questions. You have to constantly think in terms of what might be new, what might be reasonable. And I think you're always advancing. And
you've recently, in recent years, I should say, got your Master's of Science in Healthcare Delivery, and you're in the new Visiting Physicians building. So with the expansion of the hospital, and from your perspective with that Master's, how do you think the healthcare delivery here is in Columbus, and for you personally?
Well, Columbus has a first-rate medical community, and that includes the doctors, the nurses, the providers, and the facility. Mm-hmm. And the Masters, I got interested to do the Masters program because of all the changes that I'd heard of, and as everybody has heard of all the different changes. It was a time where people were wondering what's going to happen to healthcare, and I really thought that physicians are really much the best group with the nurses to determine which direction healthcare should go.
While you're being here in Columbus, what is it and why is it someone would maybe need to come see you and seek your treatment out?
So I specialize in spine surgery. So the patients who come to see me have either neck pain and or arm pain, tingling, numbness, weakness. Sometimes the pain has come on slowly, gradually over years. Sometimes it's an accident or an event, such as a car accident. Also pain throughout the middle portion of the spine between the shoulder blades, or pain that's in the low back and can radiate down the legs. People have heard of sciatica. That's where the pain would go down a nerve in the back of the leg and can even reach the foot. Then it's a matter of then coming up with the best game plan. The majority of the game plans are non-surgical. We're trying to find ways to treat people without surgery as the first line of treatment, because it's usually the most effective. Obviously, it's the least invasive, and it is less risky.
And I was just going to ask you, when you talk about that surgery aspect, what are some of the things that you are doing?
So the surgery that we've been doing here is low back surgery with the use of the microscope. So we call them microdecompressions or microdiscectomies. The disc is a cushion between the vertebrae, and it is often a culprit for pain because in the low back, those discs are under repetitive pressure and stress, and they can get tears or fissures. Just think of a fabric of a seat cushion pulling apart, and some of the stuffing that's within the seat cushion sticking out. Well, when it sticks out, of course, it can rub on a nerve, and so we'll go in and identify where the nerve is, where the pinch point is, and whether it's a bony spur or a piece of disc material, we'll trim and or remove that so that the nerve has more space. This can be done through a small incision, often not much more than an inch in length, with a microscope, and not taking much more than 1 hour, and typically less than an hour. The patients can go home the same day, which is nice to be able to do the surgery in the community, because then they don't have to travel far. They can get home and they enjoy going home. If they have to stay, for instance, some sort of symptom, or perhaps if an older folks, they might decide that it's best to stay the night. Again, a great facility overnight to stay.
So, Dr. McCullen, I appreciate you joining me, and thank you guys for tuning in to another edition of Meet the Docs, brought to you by the Columbus Community Hospital. We'll see you guys next time.